Hello everyone. Today we are going to discuss about an important topic about subdural hematoma. Subdural hematoma is very common actually if you compare it with the epidural hematoma, which is its counterpart actually. So now let us dive into the topic. So this subdural hematoma by definition is a type of bleeding actually, or a collection of blood that gathers between the inner layer of the dura mater and then the arachnoid matter of the meninges. That is bleeding bleeding or blood collection. Blood collection from the word hematoma. Hematoma means blood outside the blood vessel, right? Collection of blood collection between the inner layer, of the dura mater. That is inner layer of the dura mater and the arachnoid matter. So this is the definition of this subdural hematoma, and this occur due to what? Due to shearing or tearing of shear or tearing of the bridging veins. So let me write them in capital letters. Bridging veins. Unlike in the epidural is due to artery, right? Middle meningeal artery, specifically anterior branch, right? So that is it. So now let us see the etiology. What causes this bleeding or what causes this blood collection actually? That's the etiology. The etiology of this is actually due to traumatic head injury, mostly due to traumatic brain injury. Traumatic head injury, sorry. Traumatic head injury. So, especially if the causative factor or the trauma involves a kind of rotational or linear forces. So, especially when the causative factor, especially if the causative factor, if the causative factor uh, result in rotational or linear forces of the head. Linear forces. For example, if there is sudden rotational or sudden linear forces that is exerted against the head, so this may lead to this kind of together with the trauma, then this will lead to damage to the this bridging veins actually. So that is it. Then we have another factor. The factor is any factor that may lead to brain shrinkage, especially old age, right? Old age in especially alcoholic dementia. So in old age and then also in alcoholic actually, all in this patient actually, they have a kind of shrinkage of the brain, half shrinkage of the brain or half brain shrinkage. Because of this brain shrinkage, brain shrinkage actually, there will going to be a kind of increase in the length and the stretch of the bridging veins, leading to this more likely to shear or more likely to tear actually. Then, especially in old age people, apart from being the brain is shrink actually, but they are having a kind of brittle vessels, brittle veins actually. So if they have due to that brittle veins, if we say brittle, so it means easily to get damaged or easy to tear. So in this old age people actually, so if you increase, they have shrinkage of brain and then plus the brittle veins, so having more likely to have this tearing of the bridging veins actually. So that is it. Then again, if the patient is under a kind of long-term use of anticoagulant and antiplatelet. So in patients who are taking this anticoagulant or antiplatelet, they have increased risk of uh, bleeding, even if not in the cranium actually. Even if, for example, GI bleeding, that is gastrointestinal bleeding, or or any like joint bleeding because of this anticoagulant or antiplatelet they are taking. So this occur due to like side effect of them. So long-term use of these drugs, for example, aspirin, so or warfarin, and then whatsoever. So that is it. Then now let us see the pathophysiology, because pathophysiology, because we have acute, we have chronic actually. So in acute, what really happens is that subdural hematomas grow continually larger within a short period of time, actually within hours actually. So if there is growing of that blood collection, so there will going to be a kind of increase or rapidly increase in the blood collection, rapidly increase in the blood collection actually, leading to rapid increase in intracranial pressure, or just say ICP, right? So which lead to squeezing of the dural venous sinus. So as a result of this rapidly increase in intracranial pressure, so there is going to be a kind of compression, leading to compression or compression of the dural venous sinus, dural venous sinuses in the cranium, right? So if there is compression of this venous sinuses, there is going to be a kind of increase in their pressure. So increase in their pressure leading to increase in dural venous pressure, So if there is increase in this dural venous pressure, so there is going to be an increase in even more bleeding. That is increase in the bleeding through the what? Through the bridging veins. Through the bridging veins actually. So that is it. Then again we have the chronic one, chronic subdural hematoma. So subdural hematoma. So what happens in chronic is the development of this or the collection of this blood develop actually over time, right? So as the blood is collecting in the dural space, so there will going to be a kind of damage to the dural border cells. So there are going to be a kind of slowly collection of the blood in the dural space. Then together with damage to the dural border cells, dural border cells actually. So if these dural border cells get damaged, so there will going to be a kind of leading to increase or triggering of inflammation, releasing of inflammatory cytokines. So this inflammation has to be chronic inflammation, because it is chronic thing actually, right? So due to this chronic inflammation, as we have already know that in any chronic inflammation there will going to be a kind of angiogenesis, right? So leading to angiogenesis and fibrosis, right? We have fibrosis and then also angiogenesis due to releasing of some factors actually that may lead to this angiogenesis and then fibrosis. So due to that chronic inflammation, there will going to be a kind of new vessel formation, that is angiogenesis, leading to angiogenesis, because this is physiological. In any chronic inflammation, there will going to be a kind of formation of new blood vessels, that is angiogenesis and then fibrosis, right? So due to this angiogenesis, that is new blood vessels, the blood vessels and the blood vessels are leaky, right? So since they are leaky, so allowing blood to be gathering in the space. but over time, that is slowly, because even the formation of the blood vessels take time, right? Not in compared with the acute one. So that is it. So leading to the blood to be gathering in the space over time. So that is it. Then this is the pathophysiology of acute and then the chronic. So now let us see the signs and symptoms of this subdural hematoma. Signs and symptoms. So signs and symptoms, actually we have from because the thing, it is affecting the scalp, right, or the head. So definitely the patient will have a kind of severe headache. Severe headache. This headache can even actually prevent the patient from sleeping. It may inhibit it, or it may interrupt with his sleeping actually. So severe headache, and the headache may be constant or may be fluctuating. Constant or fluctuating. Then due to increase in ICP, because in anything that may increase in the ICP, then definitely there are going to be a kind of, the headache will going to be even exacerbated with, for example, yawning or increase in basal maneuver. So this may, or even coughing or sneezing, all this will going to exacerbate the headache of this patient. And also due to this increase in ICP, anything that may lead to increase in ICP, not only bleeding, even if it is tumor or whatsoever, there are going to be a kind of nausea and vomiting. Due to this increase in ICP, nausea and vomiting may occur. Then the patient may lose consciousness, loss of consciousness. Again, the patient may have trouble with speaking, that is inability to speak, or may have slow speech in actually, slurred speech. Again, the patient may have blood vision. The patient may have weakness, may have altered breathing pattern. Again, the patient may suffer from, for example, disorientation. So sometimes the patient may even have ataxia. So that is it. Because this blood is compressing against the cortex, right? The cerebral cortex and then the cerebellum or whatsoever, depending on the extent of the bleeding or collection of the blood. So that is it. Then now let us see the diagnosis. How can you diagnose or confirm whether if it is subdural hematoma? As with the epidural hematoma, the most important aspect in diagnosis is to order for CT scan. CT scan. And in that CT scan, you will notice the patient if to have actually a kind of high density crescent shape. This is very, very classical. Crescent shape hematoma. Again, in the CT scan, the patient will have a kind of swelling of soft tissues around the temple, around his temple. So that is it. So now let us see the CT scan. So this is a CT scan. So this is the hematoma. See, it is crescent shape, right? It's just like crescent because it may diffuse. For example, let's say if the bleeding started here, it may diffuse up to this side. It may even go extend this area actually. Why? Because no suture in the subdural space, right? So if there is no suture in the subdural space, definitely the blood can go around. So nothing will limit its movement, right? Nothing will limit. If to say there is suture, definitely the blood will remain here, for example, remain localized. So let us see, for example, as in the case of epidural. See, because it is suture can limit the movement of the blood or of the hematoma. So that's why the blood collect only in this, leading to a biconvex, right? So this is biconvex. So this is epidural hematoma, while this is crescent shape. So because there is no suture. So this is the swelling of the soft tissue around the temple. So that is it. And this collection of the blood mostly occur in the frontal or parietal. That's frontal and parietal actually in most cases. So, or even to say in all cases actually, occur in the frontal and then in the parietal area. So that is it. Then now let us see the treatment. Treatment. How can you treat this? So depending on the size, depends on the size of the hematoma, and even the growth rate. Because if the hematoma is expanding very quickly, then the treatment has to be different from if it is growing very slowly, right? So that is it. So then, if the blood collection is larger enough, if it is very large, if it is very large, then craniotomy has to be done. So that is it. Craniotomy is the most important surgery to be carried out. But sometimes even if the collection is small and then didn't resolve spontaneously, because if it is small, it may even resolve spontaneously. But sometimes catheter has to be used to drain. Catheter has to be inserted to drain it, to drain the blood. But if it is larger enough, actually, the craniotomy is more important. So, thank you very much.